Heart failure doesn't have a simple definition, but my favourite one-sentence one is the heart's no longer doing the pumping job that it's designed for as well as it should do. So either it's having to work too hard to achieve what it ought to do without too much work, or it's no longer able to deliver blood to the organs in the way it's meant to. Heart failure can occur at any age, but it's much commoner as people get older. And because we're better at treating other conditions such as heart attacks now, it is becoming much more common in older age groups, particularly people in their 60s, 70s and 80s. But it can occur at much younger age groups and even in children. So most of the time, heart failure in this country is caused by damage to the heart muscle by a problem with the blood supply. Other causes, there's quite a lot of them, but changes from high blood pressure, some hormonal conditions, very rarely as a result of pregnancy, valve conditions. There are a lot of things, but most people will have had a heart attack or something similar to have damaged their heart, and that's the major cause. The early signs of heart failure can be quite subtle, but typically an individual may notice they're becoming a bit more breathless with activities which they managed perfectly reasonably only a few months ago. They may notice that they have to sleep a bit more upright using 3 or 4 pillows rather than just 1 or 2. They may notice their ankles swelling, whereas previously they were always slim and didn't even show swelling on a warm day. These would be the major conditions I'd ask someone about. Heart failure certainly can improve over time. A lot of people with heart failure find that with appropriate therapy, both their symptoms improve and their overall outlook improves. And some types of heart failure, you can expect to get almost normal cardiac function back, or in rarer cases, completely normal cardiac function. These are relatively uncommon, but they do exist. But most of the time, adequate medical or cardiac therapy can make a real difference to people. So if we're considering a diagnosis of heart failure, there's a lot of tests we can ask people to undertake. These may be something very straightforward, from a regular ECG, where we record the heartbeat, an echocardiogram, which is an ultrasound scan of the heart, to more complex or invasive tests like a coronary angiogram, which is a sophisticated X-ray, or cardiac CT or cardiac MR studies. There are also some more sophisticated tests involving minute amounts of radioactive tracer, which can be injected into the circulation to see how it distributes in the cardiac muscle, or more complex forms of cardiac MR study, which also use tracers. So there's now a wide variety of things which are used to assess heart health, and your cardiologist will go through those with you if that's relevant.